Here at Grady, we have some standard precautions that control the spread of disease and minimize the number of healthcare-associated infections. Here are the most important ones. Grady Hospital develops and implements protocols for identifying and preventing the spread of high-consequence infectious diseases or special pathogens at the point of care. This may include emergency department, urgent care, ambulatory clinics, triage area at the emergency room, electronic check-in prior to appointment for ambulatory clinics, and at the time of admission to the hospital. Routine screening should be done using a syndrome-based approach. Fever, rash, respiratory symptoms, and travel history to determine if the symptomatic patient traveled to an area with an active outbreak. Any patient who screens positive should be placed in isolation following infection prevention and control guidelines. The World Health Organization has set guidelines for when to wash your hands. Clean your hands before touching a patient, before performing a clean or aseptic procedure, after an exposure risk to body fluids, and after glove removal, after touching a patient and their immediate surroundings, and after touching any object or furniture in the patient's immediate surroundings, even if you didn't touch the patient. The World Health Organization also set guidelines on the hand rub procedure. The fingernail policy for clinical staff requires all employees to have clean nails no longer than a quarter inch. Artificial nails are not permitted. We also use transmission-based precautions, which are additional forms of protection. To stop the spread of infectious agents that are transmitted by touching, follow hand hygiene protocols before and after patient care. You should also wear gloves and a gown when entering a room. To stop the spread of C. diff, norovirus, diarrhea, or other enteric diseases, follow hand hygiene before and after patient care, and wear gloves and a gown when entering the room. Use soap and water for hand hygiene, not alcohol rub.
Wait, you'll need to wear a gown too.
I do?
We think the patient has norovirus, so you'll need gloves and a gown.
Oh yeah, that's right. Thanks.
To stop the spread of infections that are transmitted in tiny droplets from coughing and sneezing, like influenza, follow hand hygiene protocols before and after patient care, and wear a blue surgical mask upon entry into the patient's room. Discard it after use. To stop the spread of infectious agents that are transmitted through the air, follow proper hand hygiene before and after patient care. Be in a negative pressure room with the door closed at all times, and wear an N95 respirator mask when in the room. Always use a Grady-approved isolation gown when there is potential for exposure to blood and bodily fluids. And if you're exposed or have a needle stick, notify the 5-stick hotline immediately. Healthcare-associated infections, also referred to as HAIs, are infections that patients acquire while they're in a healthcare setting. HAIs are completely preventable when we all follow these protocols. These precautions also fight the transmission of multi-drug resistant organisms, commonly called MDROs, which are bacteria that have become resistant to certain antibiotics. They are an increasing threat to public health. Let's talk about antibiotic stewardship. Did you know that between 30 and 50% of antibiotic use is unnecessary? Antibiotic overuse put patients at risk for resistant infections or C. diff infections. Through antibiotic stewardship, we can optimize clinical patient outcomes, minimize unintended consequences of antibiotics, like antibiotic resistant and C. diff, and reduce healthcare costs without adversely impacting the quality of care. Grady Health follows the Center for Disease Control recommendations for antibiotic stewardship. They recommend leadership commitment, accountability, and pharmacy expertise. This is Grady's Health Antibiotic Stewardship Leadership Team. Together, this team is taking action, tracking outcomes, reporting, and educating about antibiotic use. We've developed guidelines around when to use antibiotics, restricted antimicrobial use, require indication for antibiotic orders, and use treatment bundles. Details about these strategies can be found on our intranet. We need to keep ourselves safe and healthy so that we can keep our patients safe and healthy. Healthcare workers who develop signs of communicable diseases can seek care from Employee Health Services, or EHS. If you get sick, you may be excluded from work duty and placed on a work clearance. You'll need to show documentation from your physician to return to work. Employee Health Services is here to educate and train healthcare workers on infection control. They're available as a general resource and for group trainings. For additional information on our policies and procedures around infectious agents, find the Infection Prevention and Control Department link on GradyNet.